back to my channel. So I took the HESI exam and I got an A. Yay! So that's the good news. The bad news is that this book was completely useless in the end. None of the things that I studied in here, besides maybe some math equations, which could be found pretty much anywhere, was actually on the exam. Not even the vocabulary words and nothing from the anatomy and physiology section. So I revised my statement about using this to help you with study guides. It was not helpful. So I like to comment and say that you should pull out your old notes from your anatomy and physiology class and then pair it with watching videos or taking practice tests and trying to refresh your memory on everything instead of using the HESI book to help you. So that's my opinion. So the first thing that I did when I was taking the exam was I took the math section because I was remembering a lot of conversions, milligrams to milliliters, teaspoons, cups, pints, gallons. I was remembering all of that, and I wanted to make sure I had it right fresh in my head when I was taking the math section. So I went ahead and I did that first, and I scored a 96%, and that was out of 50 questions. So that was very good for me. So then the second thing I did was actually anatomy and physiology, which, like I was saying, none of the questions that were on the test was something that was in the book that the HESI had given, the HESI exam book had given, and there was a lot of questions about bone reformation. There was questions about skin cancer. That's, something to note. And there were questions about the heart. It asked about which part of the heart has the thickest wall, and asked about hormones, about how it's released, if it's in the blood, if it's in ducts, or goes through the nerves. So hormones, how they release and how they affect the body is definitely something important to note. So that was pretty much all the questions. So there was 30 questions and I got a 96%. So that means I only got one wrong, which was awesome. I'm glad I actually remembered things from the anatomy and physiology classes I was taking. So the next section that I did after that was the vocabulary, and none of the vocab words that I was studying for was on there, but thankfully it was for my general knowledge. I actually remembered a lot of what those words were from just past experiences, so I didn't do too bad on there. Out of 50 questions, I only got 5 wrong, so that was really good for me. Then after that, I went ahead and did the critical thinking section, and it was a score between 0 to 1,000, and I got 900. So for me, I felt that was really good, especially going into the nursing program and not actually having that knowledge. And the questions that they give you were kind of similar to what you would see on an NCLEX exam. So all 4 choices are correct. You just have to choose the one that's most correct. And they'll give you questions about 4 different patients. One of them was a 17-year-old asthma patient who was smoking in the bathroom for 30 minutes, and cardiovascular patient complaining about the TB, and there was one about a kidney infection girl and having hematuria, and then there was one that was post-op and had dressing change needs. And then it asks you which would you go to first. So it was kind of nice to see those questions and maybe get a feel for what I'm going to be experiencing in the nursing field. So then after that, I went ahead and did the personality profile and the learning experience, just because I wanted to do the reading section last. I thought that would have been the easiest, just because I have been reading books my entire life, and I enjoy reading, and I feel like I always have interpreted what the author was trying to say to me very well, but when I took the exam, my mind was completely fried by the time I got to the reading section. And I got an 86%, which for me kind of sucks. And I wish I got an A on that one specifically. But overall, I still got an A for the entire exam, so I'm not going to be too picky about it. The thing that I would recommend is to practice with reading paragraphs and interpreting what the author is trying to imply and, what they're actually trying to say to you. And just keep doing practice questions in regards to that. There was one that I found was kind of weird. It was about the white elephant, how it started and how it became into our world. And it started in Thailand. And the first question that it asked was, where is Thailand? And I'm sorry, I didn't study geography before I started taking the nursing HESI exam. And I don't travel. I never go out of the country. And for the life of me, I could not remember where Thailand was, if it was in Asia or South America. But then I was trying to find it in the paragraph somewhere, and there was nothing in the paragraph that told me where Thailand was. And so I had to guess, which I felt kind of bad for me. I don't like guessing. I want to know the answer. So that one, it was kind of weird. For my final thought on the HESI exam, I would say first, don't buy the HESI review book. I felt that I wasted my money and I can't get it back. YouTube videos definitely help. Watch as many as you can. Bring out your old notes from anatomy and physiology and review everything. I would specifically think like this is for nursing. So you will want to know about bone formation, you want to know about diabetes, you want to know about hormones, things like that. So try to gear it specifically towards those kind of things. And so the last thing would be make sure you practice. Do practice tests, go to different websites. There are lots out there that you can actually practice for. And just keep at it and give yourself time to study. I gave myself a month and I got an A on the exam. So timeliness is definitely key in trying to make sure you remember all of this information and it's engraved in your brain. So those are my final thoughts. If you like this video, give me a thumbs up, leave a comment, and subscribe if you want to see future videos. Thanks for watching. Bye.